from the immunization.
Sue, you're gonna send us the recording?
Yeah, I'll send you the recording. I've got to send you the one from the other day too.
Okay,
I like
thank
to
you.
send you the recording so that this way you guys have a chance to go back and read through the different rationales and all.
Yes.
Aspirin should be able to control unless the patient becomes more aspirin.
Okay. The nurse is reinforcing education to a client with a venous thromboembolism who is prescribed rivaroxaban. What's that?
That's a bleeding medications.
Okay, it's an anticoagulant, right? Like Xarelto or something like that. All right. Which statement by the client indicates that medication teaching has been effective? So let's talk about one. Okay, spinach and kale. Why would they put that answer up there?
Bleeding.
Because they have vitamin K, right?
Mhm.
Because they have vitamin K. Do we have to worry about vitamin K with rivaroxaban?
Yes.
Not really.
Mm.
Coumadin is the one we got to worry
Oh,
about with
Coumadin you
vitamin
got to
K.
worry
Oh,
about with the
okay.
vitamin K.
Okay, not really the other ones. The other ones are anticoagulants, but Coumadin, vitamin K is the antidote. So that's why you can't eat. You can eat things with vitamin K. It's not that you can't eat them. The thing is, what we want our patient to do is eat a continuous level, like a steady level. Don't go way up or way down on the level, because when we check your blood and we draw, we base on what your current dietary intake is. So if you were to suddenly increase your intake of like spinach or kale or something like that, it could actually change your INR levels. So
Got it.
that's why we, talk about that. Okay. I will probably have some weakness in my legs when I take this medication. I don't know. Maybe you will. I should avoid aspirin while taking this medication. Well, if it's an anticoagulant, we always know that the NCLEX and the Board of Nursing doesn't want us to give additional anticoagulants unless we have to. And then I'll have to get my blood routinely drawn to check my clotting levels. So again, that's asking about the PT-INR levels. Do we need to do this routinely with this drug?
No, they don't get that done routinely.
Okay, so that one's another, again, a Coumadin or a heparin thing, and we know that's a Coumadin thing. So now it leaves you down to two choices, and actually one of them is very obvious. The other one, if you haven't heard of it before and you have an obvious choice, then unless for some reason you could validate why you would pick that other answer, then I would stick with my obvious choice.
Oh, so you're saying 3 then? I should avoid taking aspirin while receiving this. Oh, I got it right. Aspirin, ginger, garlic.
So I call those the 3 G's: garlic, ginger, and ginkgo. All right. They can cause additional bleeding. So I call them the 3 gangsters. Okay. Because they can come in and make you bleed. Boom, boom, boom. All right. Garlic, ginger, and ginkgo. Those are the 3 gangsters you have to be careful of with your anticoagulants, and also NSAIDs, aspirin, other things that might cause extra bleeding. All right. And so again, it's a factor XA inhibitor. All right. So it's not affected by K, and you don't need clotting times because it's not affected. So this is why I like you, world, because as you see, this brings you exactly what you need to know about that drug. You still can always look up things and increase your knowledge, but the more you increase your knowledge, the easier it's going to be for you to answer certain questions. All right, so we have a 5-year-old child. The mom calls the clinic to report nosebleed that keeps going over and over again. All right, so how are we going to stop that nosebleed? What are some things that we would do? What instructions are we going to give the mom? Well, let's start with the bottom. I like to start with the bottom with the select all that apply. All right, so that way we don't miss any answers. So are we going to take the child to the ER? They were seen a week ago, and now the nosebleed came back. Are you going to take the child to the ER? Talk to me.
I mean, if,
It depends.
You're not, right? Not unless there's something else extenuating here. The child is not bleeding from anywhere else. So the first thing you're going to try to do is stop it. Now, if you've done all these other measures and you can't stop it, then you're going to recommend. Okay. But you're not going to, that's not going to be your first action or one of your first actions. Okay. How about having the child lie down and turn to the left side?
no.
Okay. No. Why?
I would think he with that blood, he might aspirate on it.
Sure. They might aspirate on that blood. How about keeping the child calm and quiet?
Yeah.
Yeah.
Okay, good. That's going to help, right? How about putting pressure and pinching those nostrils together?
Yes.
Yes.
About a cold cloth to the bridge of the nose?
You can do that.
Yeah.
Where else could you put something cold at that might help stop the bleed?
Oh,
To the back of the neck. You could put an ice pack to the back of the neck, and sometimes that would help. And also you want the child to lean forward and put their head down, right? So that that blood isn't running down the back of their throat. All right, so direct continuous pressure to the soft area for 5 to 15 minutes. The cold cloth to the bridge of the nose or the back of the neck, okay, or an ice pack. And then keeping them calm and quiet. And then, of course, you're not going to put them on any position that might promote aspiration or swallowing of the blood. All right, Kawasaki disease. What's that? Come on, nurses. I know you know this. You've had peds. You're getting ready to go in. All in. What is that Kawasaki disease?
is this a muscle disorder?
Well, it's anti-inflammatory, right? It's an autoimmune, I think. It affects the heart, right? They're going to have this anti-inflammatory response in their body. We're seeing this a lot with kids that have COVID, Kawasaki-like syndrome. Who's familiar with this? Come on, nurses. It causes inflammation in the blood vessels in the body. All right. It's also known as lymph node syndrome. So first they'll get like a rash and a fever. Okay. The skin might start to spill to even pill. And then later we start to see inflammation in blood vessels throughout the body, lymph nodes, skin, mucous membranes. So they're getting IV immunoglobulin, IVIG. What's that for?
Are they giving them antibodies?
So yeah, they're giving them antibodies. All right. And it's to try to help reduce the risk of damage to the coronary arteries in the heart. So what do you think you might be worried about?
I'm not sure, but from what I can remember of this, you're not supposed to get them a live virus.
Okay, so I'd probably be looking at least 3 and 5, right?
Yeah.
Yes.
Miss Sue, I gotta mute for just a minute. I'll be right back.
No problem.
So are we not giving live viruses because they have Kawasaki disease or because of the immunoglobulin?
I'm thinking because of the immunoglobulin.
Okay. And how does a live virus interact with the immunoglobulin?
So if we're giving them antibodies, I would think that it would cause them to attack.
Okay.
So
Well, I do think the answer is 3 and 5, but I mostly think it's 3 and 5 because at 12 months, that's their scheduled vaccine. They've already had their HIVs, they've already had their Hep Bs. They should get that 2, 4, and 6 months, and they've already had their Prevnars, but they get another one at 15 months. So that's
no,
why.
they don't. You can't give a baby pneumococcal vaccination until they 6 months or older.
Well, you get that at 2 months, 4 months, and 6 months with their pediatric vaccines.
Which one?
The PCV.
For the
The
pneumococcal?
Prevnar.
Oh
Yeah,
wow.
they get that 2 months, 4 months, and 6 months. But their scheduled vaccines at 1 year old is MMR, varicella, and they get I think they're 50 tap. So yeah, that's why I will
That's right, 12 months. So he would
at
get
12 months. Yeah, so
okay,
that's why I
12
will
months.
hold off the MMR and varicella because that's their scheduled vaccine.
So it's the MMR and
And
those two live vaccines anyway. So you got
they're
to get rid of them.
exactly. And it says they're scheduled for a follow-up and they're scheduled for immunizations, and those are the ones that's scheduled.
I
So
don't know. 12 months ago. With I don't. But the pneumococcal, isn't that a live vaccine too?
No, I don't think that one is. I think it's an inactivated. Because the
So I believe the pneumonia is not activated.
yeah, only the varicella and the MMR, I believe. Definitely varicella is
So it's only 3 and 5.
I believe it's 3 and 5, yeah.
Okay, good. So with the Kawasaki, it's treated with aspirin and IVG to prevent coronary artery aneurysms. All right, so the antibodies from the IVG will remain in the body for up to 11 months and can interfere with the desired immune response to a live vaccine. So that's why you can't give them.
Got it.
All right.
May I see what the answers were to that, Miss Sue? That question? All right, so you would delay those two.
Because they can interfere, the IgG can interfere with the immune response.
Okay, all right.
Are you okay? I guess I don't hear an answer. I just hear her screaming. She'll survive. Okay. A client with Polycythemia Vera comes to the clinic for a monthly treatment. The nurse knows treatment for this condition consists of which of the following. So what's happening here with this patient?
They got too much blood here.
All right, too many red blood cells. So their blood is what?
Thick.
Thick and viscous. Okay, so we have to worry about, them throwing clots amongst other things. The other problem is when the blood cells become overcrowded, sometimes it can cause the other blood cells not to work because blood cells don't like to be crowded. They like to have a lot of space to live in. They like actually to be social distancing all the time. All right, so what kind of treatment is going to help this patient? So let's talk about steroid injections. What do they do?
They're anti-inflammatory.
Okay, but they also can build platelets and make our platelets strong and stuff like that, right?
Mhm.
But we don't want to build. I don't think
Okay.
you want to build here, right?
Okay. What
Okay.
else is next? Phlebotomy. What's that?
That's they taking some blood out, right?
Okay, they're removing blood. Okay. What about a fluid bolus? Would we treat this patient with fluids?
Nah, yeah, overload.
Well, we would treat them though with fluids, but generally we're going to have them drink a lot of fluids, like 2 to 3 liters a day, because we want to try to thin that blood out. We're not giving them fluids in a bolus unless we can't get them to drink or something like that. But we're looking at a monthly treatment. So we're not bringing them in once a month to give them a fluid bolus. We need them to drink fluids every day. Right?
Yes.
And what
Yes.
about a blood transfusion? Does this patient need a transfusion?
Nah, he got enough of that.
No.
Okay. So we can eliminate that. We can eliminate that. And you said we can eliminate that. So that only leaves us with one option, right? A
Mhm.
phlebotomy. So we could actually bring them in and take off like 500 cc's of blood and try to help eliminate some of their issues. So again, just think about, things about the disease, what kind of things would help this patient and why. And knowing, it's going to cause a problem with the blood marrow. Okay. It also can happen in someone who has chronic hypoxemia like COPD because they're chronically short of breath. So the body in response just keeps producing these red blood cells, trying to make up for the fact that they are not breathing well. But that's not really their issue. Okay. Their issue is at the end of expiration, the bronchioles are collapsing because they've lost that elasticity. So their body's retaining carbon dioxide. All right. That's what's causing them to be hypoxic. But the body doesn't recognize that. All it recognizes is that the cells aren't getting enough oxygen. So it keeps producing these red blood cells, trying to get more oxygen out to the cells. The nurse reviews the serum lab results and medication administration record for the assigned clients. Which prescription should the nurse question and validate with the healthcare provider before administering? Select all that apply. All right, so the first one is Metrodonazole in a client with C. diff who also has leukocytosis. Isoniazid in a client with latent tuberculosis who has elevated liver enzymes. Carvedilol in a client with heart failure who has elevated B-type natriuretic peptide. Calcium acetate in a client with chronic kidney disease who has hyperphosphatemia. And bumetanide in a client with heart failure who has hypokalemia. So it wants to see if you know what these medications are and how they're going to affect. So metrodonazole is an antibiotic, right? Or an antifungal, actually, right? Flagyl. We use that in a lot of female issues. But it's also a broad spectrum antibiotic that's used along with Vanco to treat a patient with a C. diff infection. Now, you already know with the metrodonazole, one of the major things you can't do is what? Come on, nurses.
I don't think you can drink with it.
Okay, you can't drink alcohol with it. Okay.
Right.
What other side effects does it have?
Are you talking about the women thing or something with women, or are you just talking about in particular?
In general.
In general.
Dizzy, headache,
I think it could cause C. diff.
constipation.
Okay. It can cause you to have a metallic taste in your mouth. All right. It definitely can make you have an upset stomach. It's this big horse pill. Okay, isoniazid, we give that to people with TB. What are the major side effects of that?
I think it could cause liver failure.
Okay, it can cause liver failure. It also causes a vitamin B6 deficiency. So generally, we're given the pyroxidine, I think it's called. Yeah, pyridoxine is what we'll give with this to prevent peripheral neuropathy. So with the isoniazid, we're monitoring the liver levels, okay? And also we're given for this B6 to prevent the peripheral neuropathy. Carvedilol, okay, what is that?
Beta blocker.
Okay, it's a beta blocker. They're talking about giving it to a patient in heart failure who has an elevated B-type natriuretic peptide. What does that mean?
This mean your cardiac enzymes are high, right?
So B-natriuretic peptide is specific for what? It's specific for heart failure, okay? We want that. That's actually secreted by our ventricles. So when we're in fluid volume overload for the heart failure, our ventricles release this B-natriuretic peptide, which sends a messenger to the brain, okay, telling the body that we're in heart failure. So the levels will go up. Normal should be 100 or less. So anything above 100, the higher it is, the worse that the heart failure is.
Mm-hmm.
The calcium acetate, so that's a type of calcium, right? And you know that calcium and phosphorus have an adverse or inverse relationship. So if we increase the calcium levels, it should lower the phosphorus levels. Okay, and then butaminide, what is that?
It's a fluid. Oh my God, to get the fluid off.
Mm-hmm.
Okay, so now
Diuretic,
we're
yeah.
giving it to a patient with hypokalemia. So why would they ask us about that? They want us to know, is this a potassium sparing diuretic or not? Because if we have hypokalemia, then we would want to probably give our patient something that's potassium sparing. So is it a potassium sparing diuretic or is it a loop diuretic?
That's a loop.
I think it's a loop diuretic, yeah.
Yeah, you won't want to
Okay,
get.
so now that's how you're going to answer these questions, right? Because you have to know these things about the drugs, and that's going to tell you how to answer the question. So what is leukocytosis?
It's when leukocytosis, the white blood cells.
Okay, they're high.
Cytosis, yeah, they're high. Mm-hmm.
Okay.
So we back to number 5. So you would want to give that. So we wouldn't
Okay,
question.
so we're not going to question that.
Mm-mm.
Okay, how about the isoniazid with the latent
Oh, shit.
tuberculosis?
No.
I think we,
You
because
don't think you should question that?
I think we should because it causes liver failure and they have elevated liver enzyme.
Okay.
Okay.
How about the carvedilol? Do we have to worry about that in a patient with heart failure?
No.
No.
All right. How about the calcium acetate?
You need that to lower the. You put that in for the. No, we shouldn't have to do that one either, right?
All right. How about the butaminide?
Yeah.
Yeah.
Okay, good job. You see, it's a process of elimination with every question that you come across. So if you can figure out why the answer is not correct, you're going to get to the right answer. And you're going to learn why you're doing it. You really want to focus in on what's the topic of the sentence and what do I know about it. So again, we went through each one of these drugs. And if you look in these sentences, what you're going to see is basically the things that we talked about, right?
Yeah.
See, number 3 talks about the ventricular stretch. 5 talks about, the metrodonazole being the first line, which you actually said that is one of the first lines, especially if the patient has the leukocytosis. All right. The nurse is assessing a 4-year-old boy in a pediatric clinic, which behaviors by the client would concern the nurse for possible Duchenne muscular dystrophy. So what kind of signs and symptoms? Now, first of all, who gets Duchenne's muscular dystrophy?
Is it more in boys?
Normally boys.
Okay, is it one of the most common or not?
It is. I think I remember it
boys
is.
too.
Mm-hmm.
Okay, how's it going to affect them as far as body-wise? What's it going to do?
It those their muscles, some with their muscles where they.
Okay, so is 5 true? Are they going to walk on their tiptoes and have these really large calves?
No.
You sure
I
about
remember
that?
that.
Wait a minute.
I remember
Sure
that.
about that, nurse? Come
Yeah,
on,
that they
nurse.
would. It would. I remember that.
Oh,
Okay.
sort of.
Mm-hmm.
How about the rigid arms and legs?
Rigidly extends. They throw their arms down so rigid. They extend their arms to catch their body.
I know they place their hands on their thighs to push
On
up.
their thighs, that's right. They push
Stand
up.
up.
But
Okay. How about the painful knees and elbows in the morning?
that's arthritis.
Usually what they're talking about here, I believe, is they're talking about like bleeding into the joints that is caused by things like sickle cell or hemophilia or things like that.
Right.
I don't remember, quite honestly, this being an issue with the Duchenne's. I can't say for sure. It could be joint inflammation. It doesn't have to be bleeding. And then 1, frequent falls and trips at home, meaning that the child's going to be a little clumsy.
Yeah. Mm-hmm.
Okay. Anything else you see there that you want to include?
Those are the 3 I could definitely say I know about it.
Okay. You
That's it.
also might see some enlargement of the heart with these kids. Okay.
Okay.
Yep, there you go.
Gower Sign.
The Gower Sign. Sex and carries by female affecting
All right. So that's that Gower sign, putting the hands on the thighs to stand up. So kind of, you might want to remember that because they might ask you about the Gower sign instead of saying that they're actually putting the hands on the thighs.
Right.
And then those enlarged calves, those clumpiness, that walking on the tiptoes. Okay. Is it talking here about, it talks about dystrophin. Assuming that's a medication or a protein that they might give. I don't know what other medications they might give for this. All right. The client has a potential radiation contamination from a disaster. The nurse should monitor for which of the following related to this contamination. So radiation, what kind of things would you expect to see if a client were affected by radiation? And we're talking about environmental here.
Environmental.
So yeah, because it's from a disaster. So in other words, you know, there was an earthquake or something like that, and this radiation spilled out into the environment. So people were affected by the radiation, and now they're coming into the emergency department. What signs and symptoms are you going to expect to see with these patients?
Right. So select all that apply. I guess you maybe vomiting and diarrhea. Maybe. Might pick that. Oral mucosal ulceration. Blood cell count. Skin. Maybe fever and raised skin.
Ulceration.
So remember, in cancer, we use radiation treatments. Why?
Kill off the
We can target certain cells, right? We can target those rapidly growing cells, like those rapidly growing cancer cells, and try to kill them. So if it's a leaked radiation, the difference is going to be is it's not aimed at a specific area, so it's going to affect the whole body, but it would do the same thing as if we were using targeted radiation.
Oh, so it'd be a low blood cell count?
And then oral mucosal ulceration.
And you're thinking 3-2?
Yep.
I don't know about the vomiting and diarrhea though.
Well, I would say that it would affect the stomach because that's one of those areas where we had rapidly proliferating cells, but I'm not 100% on that.
It was one of them. Fever and raised skin wasn't.
So again, remember that when we make something that we make for chemo, and this radiation is no different. It's the same radiation. The only difference is we're targeting it in on a specific area when we use it for treating cancer. We're always targeting those rapidly proliferating cells, okay? Those that grow in the mouth, the GI tract, and the bone marrow. All right, and then eventually it will get some of those in the tissue, all right? The cartilage, the bones, the kidneys. And if you guys watch that lady I told you about, Charlotte Barker, she talks to you about this. Did you guys watch her?
Yeah, I did watch it. Yep. She did. She broke it down pretty good.
Yeah, she talks to you about all this. That's why I like her, because, you know, it's just a little extra resource to help you understand a little better.
Right.
What's her name?
Charlotte Barker. And she has 3 videos on YouTube called Anti-Neoplastics 1, 2, and 3.
Okay, thank you.
It takes about 45 minutes to watch all 3 videos, but I feel like it's worth the investment.
Yeah.
Definitely.
All right. The nurse is assessing a client in the outpatient clinic who has a cast on for a distal humerus fracture. Which statement made by the client would be priority to assess further?
Be priority.
Would it be the infection?
Yeah, that warm spot. That warm spot, and I'm having problems extending my finger since this morning.
Well, it might be 4, but I'm thinking that 1 is more of a priority than 4, because 1 is a circulation issue, and 4 it would be infection. So if they do have the compartment syndrome, you would want to address that first, and then you could deal with the issue about the infection. That would be my guess. Okay. These questions don't always come out the way I think they will.
No, that makes sense. You always gotta check circulation.
And actually, it's Volkmann contracture,
Oh,
not even
Volkmann
compartment
contracture.
syndrome, but it is as a result of the compartment syndrome. So again, you'll do this first because this is a circulation issue, and then you'll come back and address your potential infection. And the other two, you know, you're not going to do. You're going to tell them don't do 3, all right? And 2, we would find some other way to try to relieve the pain, or maybe have to give him some kind of food or something, you know, so that he can take something if the pain is that severe. And generally with, you know, once the body part is casted and you get used to the cast, you know, people don't generally require chronic pain medicine for broken limbs, usually. Depends on, you know, where it is and what the severity is, though. Rib fractures are a little bit different because they hurt no matter what. All right. And you guys know when someone is complaining of breathing and chest pain, okay, and they say they fell, I don't care if they have bruising or not, you're looking at a potential rib fracture. You got to get that checked out. Now, I had this with the nurse the other day, so I came into the building to do something totally different. And the boss asked me, hey, can you go down and check this patient because they don't look right? So I go to check the patient, and what I find out from the nurse is, first of all, the patient's heart rate was 134. That should have prompted some intermediate phone call or something, one would think. But the nurse said she was just going to watch it. I don't understand that, okay? You're not watching a heart rate of 134. That should be really, in all honesty, I could have charged that nurse with a Daniel's Law violation. Because if a patient has a heart rate of 134, that's a sign of acute pain. All right. And then the patient's saying that they're having difficulty breathing and they fell and they're complaining about pain in the left side of the chest, the rib cage, and the back. That should be an indication to you that there's a pretty good possibility that that patient has a rib fracture. All right. And then you go back and you look in the patient's chart and the patient is on something like Fosamax. Okay. Those 3 things together, you can't not rule it out. So, you know, I check the patient's heart rate and pulse ox. The heart rate, when I get there, is 108 and the pulse ox is 91%. And I sent the patient to the ER and they have a fracture of the 9th and 10th rib. So you looking for those obvious signs, you got to be able to put 2 and 2 together. You really have to know all these different things in order to make that connection. And that's why I tell you to do this brainstorming, because if you don't, then when you get on the floor, you don't always make the right choices when you're out there because you don't know the information well enough. And that's really more about this than, I mean, it's also going to help you answer test and questions on the test, but you really got to know it. All right. The nurse is teaching about cervical cancer prevention during the Women's Health Conference. Which factors should be taught as risk for cervical cancer?
HPV.
Okay. Having HPV,
What about multiple sexual partners?
multiple sexual partners,
HIV.
HIV history. How about nulliparity? What's that mean?
A
No
woman that have
children.
no children. That's actually one. But
All right. And how about sexual activity before 18?
Yeah, I think that is a risk factor because I believe if they're sexually active before 18, they have to get a pap smear before 18, but if not, then after 18, I think.
So it's definitely sexual activity at an early age.
Right.
Mhm.
Right.
Okay. Not sure about the 18, but definitely at an early age. And I don't know what they consider early on here.
Mm-hmm.
All right. So it's not the nulliparity. But you got a few things there. And you've actually got, if you look right here, okay, here's your 6 things you need to know about cervical cancer. Remember, I said you got to know about 6 things about everything. There's your 6 things.
You said 5, Miss Sue.
Okay, well, now I increased it to 6. How about that? 6 is a luckier number, unless it's in quintuplets.
Let me see.
Then you got to watch it. Okay,
So can you hold on for 1 second?
sure.
No, okay, I'm good.
Okay, sickle cell. What do you guys know about that?
Autoimmune disease.
Okay,
Cells are sickle shaped. Lots of
and that
pain.
causes them to do what?
With the
Lots of
cells,
area.
Yeah.
they
Because
sickle.
they're sickled, what happens?
They bunch up in one area and they don't get enough oxygen.
Okay, it bunches up in one area and it doesn't get enough oxygen, and that's actually that ischemic thing there. We call that ischemia, right? The blood or the cells aren't getting enough blood flow or enough oxygen, so it's what's causing that pain. Eventually, it could cause those cells to die if we don't get enough oxygen to them. So that's another thing that happens with these blood cells is they die young, right? They don't live that full 120 days. They're dying very young. Things we have to worry about with these patients. What do we have to worry about? Could this patient have a stroke?
Yes.
Yes.
Okay. What happens if we take them into high altitudes? Or if we expose them to high levels of stress? Or if we don't hydrate them enough?
You can kill them.
Okay, or put them into a crisis.
Crisis.
All these things. Okay, so you want to think about these patients. They need fluids. They need low energy entertainment. I might have to treat them different if they travel into higher altitudes that they're not familiar with. Okay, the cells can sickle and clump in the body and cause things like ischemia, causing tissue necrosis, pain, cells to die. And how am I going to treat that? What am I going to teach these patients, and what am I going to teach their parents? All right, so the client, it's a teenager. So now you also have to think about what is the developmental stage. All right, so they have this prescription for IV morphine, 2 milligrams every 4 hours, and they look like they're comfortable while they're watching TV. But they tell you that they have severe intolerable pain and rate it on a scale of 1 to 10. What action should the nurse take?
We can get rid of 1 and 4.
Now 2 and 3. Whew. So would you call the physician and ask for a PCA pump since they're having a crisis?
Possibly.
Is Demerol stronger than morphine?
I want to say we don't use Demerol anymore.
So I guess it's 2.
Because of cardiac or something, but I might be wrong with that. I might be thinking of something else, but that's what my brain is saying. Well, anyway, we don't use it for the sickle cell crisis, so I guess my brain was trying to tell me something. I want to say I used to be on Demerol, and I don't think I can get it anymore because I think they only make it, I think my doctor stopped giving it to me because some cardiac issue and something else.
Oh, okay.
That was like years ago. That was like 15 years ago when
Oh.
they took me off of that because of, you know, it can cause issues, the Demerol. All right. We're gonna do a couple more of these and then we'll go into your book and do some from there from some of your chapters. All right, the emergency department nurse prepares a male client for surgery. Hopefully this is helping. The client was admitted with a traumatic open fracture of the femur, hematocrit of 36%, hemoglobin of 12. Which prescription should the nurse validate with the healthcare provider before administration? So it's the femur and it's a male client. So what are we worried about? What's common in these clients with these long bone fractures? Come on.
Is it fat embolism?
Yeah, the fat embolism.
Okay.
Which prescription will the nurse validate with the healthcare provider before administering?
When they say validate, does that
You're
mean
double checking it.
okay, you're questioning the order?
Yeah.
Okay. So
Maybe the Lovenox?
Okay, what would be your rationale for questioning it?
Well, I don't know why we're giving it. Like, it doesn't treat fat embolisms.
Okay.
And the person's not bleeding, are they?
Okay.
I wouldn't know why they ordered it.
A hemoglobin is post-surgical. This patient is post-surgical,
Oh, okay, so they're trying
but the hemoglobin is 12. And what should it be? We would expect it to be a little low post-surgical, but what would be a normal hemoglobin for this patient normally?
14 to 16, I think.
For a male.
Okay, about 14 to 17 for a male. Okay. Anybody else want to take a stab?
he has a fracture, open fracture of the femur. So
I mean, Michelle might be right. I'm not saying she's right or wrong. I'm just saying, does anybody else have any thoughts?
you will want to get the tetanus shot. You will want to get an antibiotic, morphine for pain, Aspirin.
So we're pre-surgical. We're preparing for surgery.
We're preparing.
Oh, they haven't
Oh,
had.
you don't want to get a Aspirin before surgery.
I see.
Correct. Okay, good job. All right, last one, and then we're going to go into your book. All right, nurse manager on a pediatric oncology unit is leading a discussion about personal coping strategies that the nurse can use to remain effective when caring for dying children, which should be included in the instruction. All right, I'm sorry, in the discussion. So she's talking to other nurses about how they can cope.
I think I would get rid of 1 and 4.
Oh, you'd get rid of one?
Coping strategies. I don't think I would pick 1.
Why, you think nurses shouldn't go to the funeral of their patients?
I think they should. I mean,
I
personally,
have gone to funerals.
Did it help you cope with the death of the patient?
Yeah, I think
Do
so.
you think it's appropriate?
I thought it was. My dad didn't think so, 'cause I was going to a lot of my patients' funerals. So you should stop going to all their funerals. But it didn't really affect me negatively.
Well, and sometimes it's not that you're going to all their funerals, but a lot of times when you're doing pediatric oncology care, especially if it's hospice, you might just be taking care of one child for,
Exactly.
you know,
And
5 or
this
6 months, not necessarily a bunch of different children.
right. And this was pediatric oncology too. It was a 16-year-old that passed away, and we had her for months, like 8 months there.
Well, do you think you should avoid expressing your feelings of grief or loss with the family?
Yes.
No contact with the
I don't
family.
think it should get not personal.
Contact the family other than and after they leave the hospital.
Personal.
Okay, definitely 4 is out.
All right, well, 4 is out.
Yeah. And we want to know what we personal coping strategies. It might be 1 because we want to avoid expressing personal feelings of grief. So I think we all, well, me and Michelle agreed with not doing 2. We crossed out 4. So personal contact with family of the deceased should end after they leave the hospital. It's probably 1. 1 is making the best sense out of what's here when you break it down. Perfect.
Okay, let's switch up to your book for a minute.
So can we go on your world?
If you guys want to go in you world and like work together like in a study session or something, and you let me know when you're going to go in it and do it, then I'll let you have my password so you can log in.
Okay.
Okay.
And you could kind of do it together. I don't know, on FaceTime or whatever. I don't know if you guys can get into a Zoom or whatever, but you could do it like that, because I do feel like it's beneficial. Now, if you guys want to stay on these questions, we can, because you can use your book when you get off with me. If
Yeah,
you
I
feel
like
like
it.
this is helping you. The idea of this is to try to, you know, beat the content into your brain about what the disease process is, how you're going to deal with it, how you're going to handle it, those kind of things. Try to get that critical thinking process going.
This goes a little.
Is it any way that we can filter it down to what our exam is on?
So, like, it doesn't split out hematology and oncology. So that's why you're getting the hematology questions. But what we can do is, like, when we come to the question, if you guys feel like it's not something you need, we can skip. Because we got 75 questions here.
I feel like we need it all, but I kind of do want to reinforce that
Some of the stuff from the book.
yeah.
Yeah.
Okay. I probably have students that might start jumping in, but their class doesn't start till 12. So I'm just giving you a heads up. Because, you know, some of them are a little anxious. They're first term students. Okay. All right. So I have chapters 39, 40, 41, 42, 15, 36, 37, 38.
Mm-hmm.
Okay.
Really the point. I got to sign in. Maternity med search. I think I got to go to runners, right? You guys are runners. I still would encourage you guys too to go in that Abrams and do some of those chapters in there also.
Oh, for the farm.
Yeah.
Yeah. I got a good review on chapter 11. I'm gonna go over 14.
Okay.
Yeah.
Okay. Palliation. What does that refer to?
Are you showing your screen?
Oh, I'm sorry. Probably not. How's that?
Better.
So if we go down, number 1 is what?
That's
Metastasis.
Okay, metastasis. Number 2 is what?
alopecia.
Alopecia. Number 3 is what?
Which,
Is it neutropenia?
Nadir. Nadir. Number 3 is nadir. And number 4 is what?
That's alopecia.
Yeah, that's talented.
Okay. Nadir. Remember that for number 3, the lowest point. All right.
That's
Of white blood cell depression after therapy.
affects the bone. Gotcha.
Okay. All right. During which step of cellular carcinogenesis do cellular changes exhibit increased malignant behavior? Any clue, nurses?
Yeah. Let me see. Exhibit increased malignant behavior.
Is it the progression?
Okay, I hear somebody. I think what you're saying is correct. I want to say it is progression. But now I heard promotion too, so now I'm kind of trying to remember.
Increased malignant, yeah, progression. Yeah. Increased malignant, yeah.
Okay, progression is the third step of carcinogenesis in which the cells show a propensity to invade adjacent tissue and metastasize. All right, so progression is in stage 3. About we can say it like that. Progression is, how about progression is step 3. This tumor is growing bigger in me. Progression is step 3. The tumor is growing bigger in me. All right. All right. Progression is step 3 when the tumor grows bigger inside of me. All right. Which class of anti-neoplastic agents is cell cycle specific?
That's the 5-FU.
Okay.
Cell cycles.
Cell cycle specific. Okay. Anti-metabolites. The rest are cell cycle non-specific. Which is a growth-based classification of tumors. So you already know that sarcoma and carcinoma are talking about what?
Is it the type of tumor?
The type of tissue that it grows in or that it originates in, right? And leukemia means that it's originating in blood because it has that emia on the end. So if we're talking about growth, then we're talking about what?
Malignancy.
Okay, so when we talk about the origin, then we're talking about the emia or the fomas or the omas. Where does it originate at? After a bone marrow transplant, the client should be monitored for at least how long?
Three months.
Okay. Three months after the BMT, I need you to come back and see me. All right. 3 months after the BMT, I need you to come back and see me.
I like that.
A benign tumor of the blood vessels is called what?
Okay, look, I'm a B because I can't pronounce anything.
Okay, hemiangioma.
Yes.
Hemangioma.
Mhm.
I have a hemangioma in me, and it's a tumor of the blood vessels. All right. That one's not as easy to remember. Sometimes they come easier than others. All right. Which procedure uses liquid nitrogen to freeze tissue, destroying the cells?
Cryoablation.
All right, good. Cryo is always going to talk about something cold, and ablation means tissue destruction or cell destruction. Chemotherapeutic agents have which effect associated with the renal system? So what is the chemo doing to the cell?
Increasing, it's increasing the uric acid.
Okay, why?
secretion.
Why is it increasing the uric acid excretion? Because the chemo is destroying, it's lysing or breaking down those cells. And as that happens, it's releasing this uric acid, all right? All right, so they can damage the kidneys because of the direct effect during excretion and the accumulation of end products after cell lysis. So urinary excretion of the uric acid increases with the use of the chemo agents. Which type of vaccine uses the client's own cancer cells?
The auto.
Okay, autologous means it's from me. Allogenic means it's from someone like me. Prophylactic is for prevention, and therapeutic is to get some desired effect. A decrease in circulating white blood cells.
Thrombo.
All right, thrombo is related to what?
Red.
The platelets.
Those platelets.
I think it's leukopenia.
Yeah. Yeah. Leukopenia. For the
Okay,
white.
because neutropenia is associated with what?
Neutrophils.
Okay. You guys will like my one for this one. So I always think about small white penis. That helps me remember this from the neutrophils. All right. Granulocytopenia is a decrease in neutrophils, and thrombocytopenia is a decrease in the platelets. Neutropenia is the neutrophil.
Right.
Now, every time I see penia, I'm
Neutrophil
going to
count.
think of penis. Every time I see penia, I'm going to think of penis.
All right. Which is a sign or symptom of septic shock?
Mental status, alter mental status.
Okay. Nothing else there you're going to see in shock, guys. Okay. The skin is not going to be warm and moist because the body's going to pull everything to the heart and the lungs. All right. Blood pressure should be low, heart rate high. All right. And respirations could be shallow and gasping because they're not getting enough oxygen. All right. Urine output is going to be decreased. The kidneys are not going to get perfused because everything's going to the heart and the lungs. which occurs when fluid accumulates in the pericardial sac or space and compresses the heart.
Cardiac tamponade.
Cardiac tamponade. You're going to have those low muffled heart sounds. Okay. DIC, that's that disseminated intravascular coagulation. Sometimes they give heparin in this. Did you know that, to try to reset the clotting factors? All right.
Yeah, I think we
Person's
learned
bleeding
that
out.
in OB, yeah.
Okay. SIADH, that's syndrome of inappropriate ADH. That means we have too much ADH in this. We're going to see the body retaining fluid, and we're going to see things like diluted levels of your sodium. So your patient is going to be hyponatremic and other things that are caused by this increased fluid that's being withheld in the body. And then superior vena cava syndrome, we normally see like with mom. Why we wouldn't want to do chest compressions on a pregnant woman flat on her back, because it could cause her to have this superior vena cava syndrome. So if I had to do chest compressions on someone who was pregnant, I would want to put like a wedge behind them and put them like a 30-degree angle and do chest compressions on them that way. And I'm going to have to go a little bit higher up on the chest because of the diaphragm being pushed up if they're late in pregnancy. All right, other things that can affect that SVC also are tumors. You see this a lot with patients that have tumors like in the lymph nodes or in the chest wall or around the heart. It can impede that vessel and cause them to have superior vena cava syndrome also. So you might see like them getting some sort of palliative surgery to either reduce or try and remove that tumor to take the pressure off of that. A lot of times that superior vena cava syndrome can also be caused by chemo agents. All right. A serum sodium concentration lower than 15 is associated with what?
Seizure.
Okay, seizure. So when you're thinking sodium, whether it's low or high, you're always going to think neuro. Sodium, you want it to be between 135 and 145. It's one of those electrolytes. It's found in a pretty low concentration really in the body. It's not extremely high. So little changes in it can make big things happen. According to the tumor, I forget what the N stands for, metastasis classification, TO means there is what?
No evidence of primary tumor.
Okay, good. Which type of surgery is used in an attempt to relieve complications of cancer?
Type of surgery.
I heard somebody say it in the background, I think.
It's palliative.
Palliative, yes. Palliative, to relieve symptoms, okay? Palliation refers to, so we said that palliation is what?
Relief of symptoms.
Relief of symptoms. Hair loss is?
Alopecia.
Spread of cancers from the primary to a distant site.
Metastasis.
And the lowest point of white blood cell depression after therapy?
Nadir.
Nadir. Good. Which statement is true about malignant tumors?
They gain access to blood and lymphatic channels.
Okay, good. Nothing else up there was true. Which does a nurse thoroughly evaluate before a hematopoietic stem cell transplant procedure?
Studies.
Blood studies. Good. So you're evaluating the client's physical condition, organ function, nutritional status, blood studies, and assessment for past exposure to antigens like HIV, hepatitis, cytomegalovirus, and psychosocial status. Also, you're looking at drug and allergy histories. Which type of vaccine uses the client's own cancer cell? Guess we're getting duplicates
Auto.
now.
Lupus.
Auto. We just did this one. Let's skip it. All right, the nurse is providing education to a client with cancer radiation treatments. The nurse determines that the client understands teaching when the client states that which type of radiation aims to protect healthy tissue during the treatment. Breaky. Don't break my heart, my achy, breaky heart. All right. A client with metastatic pancreatic cancer underwent surgery to remove a malignant tumor in the pancreas. Despite the tumor being removed, the physician informs the client that chemo must be started. Why?
To prevent metastasis.
Okay, because it can still grow, right? Something could have been left behind that we didn't see or didn't catch. A client with a brain tumor is undergoing radiation and chemo for treatment of cancer and has reported swelling in the gums, tongue, and lips. What is the most likely cause of the symptom?
Stomatitis.
Okay, stomatitis. Nadir is that lowest blood cell count, remember? Neutropenia is the absolute low neutrophil count. All right, and extravasation is when that chemo drug seeps in around the IV and starts to kill that tissue from that vesicant chemo agent that you gave. A client is undergoing chemo for prostate cancer and has lost considerable weight due to nausea and vomiting. Which nursing intervention is appropriate for the client?
Adjusting the client's meal plan.
Okay, because the other ones, we're not going to give them fresh fruits. Beta blockers aren't going to help. And decreasing dietary fluids, we don't decrease fluids unless what?
Fluid overload.
Yeah, we never decrease or restrict fluids unless it's going to cause the patient more harm than good. So they're in heart failure, they're in renal failure, they're retaining fluid for some reason. So you can almost always eliminate that as a choice. Not always, because there's never an always in nursing. Remember that. There's not a never, there's not an always. The nurse is carrying, there is one always, I'm sorry, always stay with the patient. That's your one always. The nurse is caring for a client undergoing an incisional biopsy. Which statement does the nurse understand to be true about incisional biopsies?
Removes the wedge.
Okay, what is 2?
Excisional.
What is 3?
Aspirate.
A biopsy?
Yes,
Biopsy,
biopsy.
okay,
Yes.
good. Okay, so we have excisional, incisional, and needle. The physician is attending to a 72-year-old client with a malignant brain tumor. The physician recommends immediate radiation therapy. What is the reason for the physician's recommendation?
Recommends immediate therapy. What is the reason?
You want to prevent it from spreading.
Okay, so if you're trying to prevent it from spreading, we're not doing B.
Mm.
Stupid. If we're trying to prevent it, we're either doing A or we're doing D, right? Because we're not analyzing and we're not removing.
So you're going to prevent formation of the new cancer cells?
Good. All right, so if we can't remove it, then we want to prevent it from getting any worse. The nurse is conducting a community education program using American Cancer Society's colorectal screening and prevention guidelines. The nurse determines that participants understand the teaching when they identify that people over the age of 50 should have which screening test every 10 years.
Is it colonoscopy? Colonoscopy.
Every 10 years, we're going to scare the crap out of you. Right? Because nobody likes a colonoscopy. Just the prep alone scares you. Nah, I don't want to do that. All right. The fecal occult, we do those annually over 50. The PSA is for prostate cancer, and the PAP is for cervical cancer, which hopefully y'all know that at this age. All right, the nurse is caring for a client with a benign breast tumor. The tumor may have which characteristic?
Low growth rate. Low rate of growth.
Slow
Yeah.
rate of growth. Okay, good. They have well differentiated cells, but a slow rate of growth, and they do not invade the surrounding tissue or generally cause symptoms. The nurse is evaluating blood work of a client with cancer receiving chemo. The platelet count is 60,000. What is the appropriate nursing action? So are we going to do one?
No.
Why?
No.
Risk for
Why?
bleeding.
Okay, risk for bleeding.
Yeah.
Okay. How about 2?
Another risk for bleeding. Avoiding the use of products containing aspirin. Yes, you want to do that.
Okay. How about 3?
You don't want to give them a raise. They're already.
How about 4?
You can give some commercial mouth for. No.
Okay, so we just like to read through them, right, to make sure that we got the best answer.
Mhm.
All right, good. We don't take temperatures rectally anymore anyway because there's way too many assholes out there and we don't have enough rectal thermometers. Oh, sorry, I forgot the kid was in the background.
They can't hear you.
All right, the nurse is preparing to assess a client whose chart documents that the client experienced extravasation when receiving the vesicant vincristine. Now, if you watch those videos, you learned a little bit about vincristine, okay, during the previous shift. The documentation also notes an antidote was administered immediately. All right, so the patient had this extravasation, all right, which I just told you was what?
It's when the chemo medication goes out into the tissue.
Okay. So, and it happened with this vincristine and they got the antidote. Now you have to prepare to assess for which condition. Select all that apply. So what do you think you're going to see there?
You want to see that?
Tissue necrosis,
No,
effectiveness of the.
oh, no. I think you want to. Wait, hold on, sir. Okay, the nurse is preparing the client documents that the client experienced extravasation when receiving the vesicant during the previous. Oh, okay, gotcha.
I think we
Tissue
had this
necrosis
question
affected
before.
Effectiveness of the antidote. Is it sloughing tissue?
I think I picked that the last time, and I don't think that was one of them.
You don't?
I
Well,
don't.
let's see.
I
Okay.
don't
See
think
what you got.
active bleeding.
Oh, it was. Okay.
Okay, so extravasation can lead to erythema, sloughing, and necrosis of the tissue, muscle, and tendons. So we give this antidote to reduce it. Now, it has to match the vesicant that we give. So when the physician orders it, it's going to be specific for whatever we're given. Sometimes it's something warm, sometimes it's something cold, and sometimes it's a specific chemical.
Can you move the question to where I could see the answers? Oh, for some reason
How's that? Can you see it?
yeah, I can see it. Okay. Thank you.
You're welcome. Really? Question? Why don't you want to move on? Let's try with the mouse. Don't get stuck. We only got 4 minutes anyway. This is going to be our last question because I'll probably have other students jumping in a second if they jump in. All right. The nurse is conducting a screening for familial predisposition to a cancer. Which element should the nurse note as possible indication?
And uncle.
Okay, so the closest, right? That's who you want, is whoever's closest, who's most immediate. When you got your guys' test is Monday?
On Tuesday.
Tuesday.
So I have put a thing out there for a couple of people to get back to me for a session tomorrow night for 7 to 9. If they don't, and you guys want to jump in,
Okay.
try to do another session.
So you'll send us a link letting us know?
Yeah, it'll be at 7 to 9 at night.
Okay.
The nurse was working with a client who had hematopoietic stem cells. So allo means from who?
Other person.
Somebody like me though, right?
Mm-hmm.
The nurse notices a diffuse rash and diarrhea. The nurse contacts the physician to report that the client has symptoms of what?
Graft versus host.
Okay, good. The nurse is caring for a client with cancer who's treating her cancer with deep tissue massage in addition to radiation therapy. The nurse documents the use of which therapy on the client's chart.
Integrated.
I'm sorry, what'd you say?
Integrated.
I think it's alternative. I
Alternative.
think integrative is when we use something else, but let's see.
Okay, so you might.
No, you're right.
Mhm.
It's known as complementary medicine. Oh, alternative is when they don't use conventional. That's right. I always get them two mixed up.
Yeah.
All right. So integrative is when we combine different therapies together with conventional. Good. Hey, if nobody jumps in, maybe we'll just keep going. Which type of immunity becomes active as a result of infection by a specific microorganism?
Naturally.
Naturally acquired.
Naturally. Mhm.
D.
Good. A 38-year-old client has begun to suffer from rheumatoid arthritis and is being assessed for disorders of the immune system. The client works as an aide at a facility that cares for children infected with AIDS. What is the most important factor related to the client's assessment?
I think with the use of other drugs.
Okay, nurse needs to review client's drug history to help her assess client's susceptibility to illness, because certain past illnesses and drug use, such as steroids, suppress the inflammatory system and the body's immune response. Which adverse effect should the nurse closely monitor in a client who takes immunosuppressive drugs?
I think it's the respiratory and urinary system. I think.
Good.
Okay.
Okay, you become vulnerable to an increased risk of infection for other infections. And you'll see this on the medications, you know, it'll tell you a possible side effect of this medication is having some super or some other infection, right?
Mm-hmm.
All right, last one, guys. I hear people coming in. Okay, a client undergoing a skin test has been intradermally injected with a disease-specific antigen on the inner forearm. The client becomes anxious when the area begins to swell. Which technique may be used to decrease anxiety in this client?
A.
Reaction.
Okay, good. All right, so what I'm gonna do is I will text you guys my UWorld stuff, okay? Or I'll
Okay.
send it to you in an email, and then you'll just have to let me know if you're going in there, and you're gonna have to communicate with each other if you're going in there without each other, because I don't want them to be hip,
Okay.
Gotcha.
Thank you.
okay?
And you're gonna send us the record.
Yeah, you know, this has to, it won't even go into a recording until after I stop my Zoom sessions for